Today I'm going to show you exercises specifically that you can do for your knees in bed. These are great if you have any osteoarthritis of the knees. The first level of doing them in bed is a really great place to start because it's going to allow you to get stronger and get more confident to then progress to the videos that we have on doing the exercises in sitting and also in standing, each one being more progressive or a little bit more challenging than the other. Hi, I'm Margaret Martin. I'm a registered physical therapist, certified strength and conditioning specialist, and have for 38 years helped folks just like you progress through the exercises. Where we're going to start today, all the exercises are done lying on your back. Why would you want to do this? Well, as I mentioned, you're going to have less pain, maybe not right away, but with time as the muscles get stronger, your knees will have more support. Two is with more support around your knees, you are going to be able to have more ease getting on and off the chair, up and down stairs, all the things that are so important to give you the quality of life that you deserve. And three, if you're preparing for knee surgery or recovering from knee surgery, these are also great exercises to do. A couple of little things you're going to need: a small roll towel, a stretchy band, and a firm pillow. So let's get started. So the very first thing I want you to do, and this is whether or not you're going to be doing your exercises at all, is before you get up and out of bed in the morning, I want you to lubricate your knees. So that's just simple as sliding your heel up and down and up and down. And always start in a range that is comfortable for your knee. And just that process of moving the knee joint allows the production of synovial fluid, which means that those first few steps that you take are going, we'll switch legs. Those first few steps that you take are going to be less painful. You're going to have more ease going downstairs because you'll have lubricated your joints first. So this is often what I tell people, just start with this. See if it helps take care of some of your knee pain, and then start introducing the strength exercises. So get all the things that you need to do the strength exercises with me. All right, let's start on the strength. So studies show that strengthening our hips is as important, if not more important, than strengthening the muscles directly around the knee itself. So we're going to start with strengthening our deep hip muscles and our big hip muscles, our gluteus maximus. So the gluteus maximus muscle is our hip extensor. It's what allows us to push down. Now you'll notice in my knee, as I push down, my knee hyperextends and my ankle actually comes off. That's not a good thing. So if your knee does that and you hyperextend, that's where your little roll comes in. You're going to place it so that it's underneath your knee joint. You want to get a straightening of the leg, but without the hyperextension. So this exercise, again, is all about your butt, but your knee comes into play. So breath in, pull your toes up towards you. Think about tightening your butt and pressing your whole leg flat into the bed, like you're trying to create an indentation into the bed. And release. We're going to do that 4 more times. I want you to be joining me here. Breath in, pull your toes in. Press your whole leg down. Again, creating that indentation. 2, 3, and release. Good. 3 more. Breath. Pull in. Press down. 2, 3, and release. Excellent. Pull in. Press down. Even if you want to get your hand on your butt, feel, oh, I'm not even tightening it as much as I can. Squeeze tight and release. Good. 1 more. Pull in, press down, and squeeze. 2, 3. Excellent. So now we're going to shift over and do the other side. If you find that when you straighten your knee, that your ankle doesn't come off and you actually have a little gap under your knee and you have a hard time straightening it all the way, then by all means, you don't need this little support underneath. So repeating everything on the right, breath in. Exhale as you pull and press the whole leg down. 2, 3, and release. Get your right hand on your right butt cheek, or if you're working on your left right now, please do that. And feel the muscles in your gluteus maximus, in your big butt muscle, tighten as you press down and release. Good. You're doing great. We have 3 more to go. Pull in, press down, 2, 3. Good. Last 2. Breath in. Pull the toes in. Press the whole leg down. 2. Tighten all those muscles up high in your butt. Good. Now you might have noticed, and so just in case it's not happening for you, toes point to the sky, kneecap still pointing up. As I press the whole leg down, I'm not letting my leg roll in or out. Excellent. Very nice. Good. On to the second exercise. For the second exercise, we're going to use a band, and we're going to tie that band around the thighs. Try to keep your band nice and flat as you bring it beneath the thighs and around. Now, how tight you make your band will determine how hard the exercise is, as well as the color of the band. So you probably have used bands before. Some companies goes from yellow to red to green to blue. Whatever your band is, make sure that you're able to do some motion with the hips. So here, I'm going to encourage my knees to be opening. Feet are hip width apart, knees are hip width apart. Take a breath in and exhale, pulling the band apart. Now you're going to feel another set of muscles deep underneath the big hip muscles that you're just using, and release. Inhale, exhale. But stretching that band as wide as is comfortable, and release. Good. Breath in and out. Keep going. Good job. Feel that nice contraction and slowly release. So coming back slow is just as important as going out slow and controlled. 2, 3, and slow and controlled. Excellent. And one last one. Breath and out. 2, 3, and release. Very nice. We're going to move to the third strengthening exercise. So you'll want for this exercise to have a nice firm roll or folded firm pillow underneath your knee, such that when you straighten your knee, the pillow doesn't totally collapse. So make sure you have that firmness that allows you to do an arc. You'll notice from the ankle coming up to straight, it's about 25 to 30 degrees. All right. Now, I like to have the other knee, if it's comfortable for you, on the pillow or up close. That helps to support your low back. But if it's more comfortable to have it straight, that's fine. Just make sure that as you're doing the exercise, you're keeping your tummy muscles nice and tight. All right. I'll do half the set. We'll do 5 on the left with the knee up so that you can see it done that way. And then when we switch, we'll have the leg straight. Breath in, just as you did before. Pull those toes. Exhale as you lift, pressing the back of the knee into the roll. 2, 3, or into your pillow. Inhale down. Exhale, pulling the toes up, pressing down. And now we're trying to think of tightening all the muscles in the upper thigh as much as possible. Breath and pull in and up. 2, 3, good. Now we have an odd number, so the last 2, we're going to just rotate the whole leg out. So as though your foot is pointing and the left foot is pointing towards 10 o'clock. Breath in, pull your toes in and lift. And that's going to help activate the muscles in your inner thigh a little bit more. And back down. A lot of people wonder, why would you want to tighten the inner thigh muscles a little bit more? or your vastus medialis oblique is the official name of it. And that's because with swelling, that muscle tends to get inhibited. So now we're going to let the other leg go down. Good. Breath in. Pull your toes in. Straighten. 2, 3, and release. Let's relax our shoulders. Maybe palms to the sky. Breath. Pull your toes in. Tighten. 2, 3, and release. And when you're releasing, again, be in control of the motion. So important. Holding. 2, 3, so that slow release, that's the eccentric control. Very nice. Now, just as we did on the other side, we're turning the foot out. On the right, it's more like 2 o'clock. Breath in, pull your toes in, and up. 2, 3 through the exhale, and down. Inhale. You can relax your foot in between, and then pull it back in, and up. 2, and that's our set. Lovely. As you are going to be gradually building to doing 10 on each side, you could build 5 with your toes pointing straight up and 5 with your toes pointing out. And let's do an exercise that's going to strengthen the muscles on the back of the thigh. So I'm going to keep the roll. I'm going to dig my heel in. And as I'm trying to create a hole in the mattress, I'm hoeing, just like I would be hoeing the garden. I'm going to be hoeing my heel, and you want to feel the muscles in the back of your thigh or your hamstring muscles tighten. So nice relaxed breath. Exhale and pull it in. 2, 3, and relax. And dig that heel in. 2, 3, and relax. Good. 3 more. For many people, their hamstrings are really weak. 2, 3, so it's not unusual if you feel like, oh my goodness, that muscle feels like it wants to cramp. It's just because you haven't asked it to work in a long time. 2, 3, and relax. And we're going to do one last one. Dig it in, pull, 2, 3, and relax. Should it start to cramp, a stretch for the hamstring muscle is straightening the leg. So that's going to help stretch that muscle that you might be feeling a cramp on. All right. We're going to switch to the opposite side. Bending the knee ever so slightly. You're digging your heel in and dig hard. 2, 3, and release. Inhale. Exhale, dig it in. And release. Inhaling as you release. Exhale, dig it in. 2, 3, and release. Just as we did with the other side, if you're feeling any stress in your back, just pull the opposite foot up, dig your heel in, pull, 2, 3, and release. Good job. If you can reach down and feel those hamstrings, think about them, make them contract more, get more muscle fibers involved. Excellent. And that was your 5. Excellent. Very nicely done. We have one last strengthening exercise to do. And that's going to be for our calf muscles. For this, we're going to need the TheraBand. Keep the pillow underneath the knee or not. I'll let you just make that decision. And we're going to find a nice center spot for our band. And that's where we're going to place one foot. All right, so from here, we want to strengthen the calf muscles. The calf muscles, their job is to help point the toes. And just like a ballerina foot. So nice. So when you're holding your band, have it around your hand and not your fingers. So not wanting to aggravate any arthritis. Breath in and exhale, press. 2, 3, and release. And 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 last 1, 2, 3, and release. And on the opposite side, I'm going to show this done without the roll for those of you who did not, who found it hard to keep the leg up with the roll. And nice relaxed breath in and exhale. Press. 2, 3, and release. We'll make sure it's up and around the ball of the foot. Breath and press. 2, 3. And 3, 2, 3. Good. And 4, 2, 3. You can create more resistance by pulling that band a little closer to you. And 5, 2, and 3. Nicely done. Good job. Okay, so now that we've strengthened the calf muscle, we can actually use the band to help us stretch it as well. So we're going to point down, and this time instead of pushing into it, we're actually going to help pull the foot towards us. 1, 2, and down. And pull. 1, 2, and down. A bathrobe belt works really nice for this. But you know, honestly, I find with a lot of my clients, if they do this even without any type of band, a lot of them are just so tight that they feel they get a really good stretch. And so even without the band, I'll do this on the opposite side. Let's do 5. These are called active isolated stretches. We're just pulling in and pointing down and pulling in and down, pulling in and down. And as you pull your toes towards you, you'll just get a really nice stretch in the calf, but you'll get a bonus strengthening of the shin muscles. Excellent. Good. I'm going to do one last stretch for the thigh muscles, but it's also going to help stretch the front of the hip. I know for many of you, you don't like to lay on your stomach, but I really, really encourage you to try to lay on your stomach. If for any reason you just are not comfortable, then you could also stretch the quadricep by letting the leg slide back and just have that nice stretch in the thigh. My favorite stretch is done on your stomach. So you can place your hands, palms down, and your forehead could rest on the back of your hand. And that's most comfortable for most individuals. Take a breath in and bend your knee. Good. Now, this is one situation where you might get that cramping in the hamstring, but hopefully it'll be warmed up from the previous hoeing exercise that we did. And as you pull your heel towards your buttock, you should feel a nice stretch in the quadricep. Now you can just hold that stretch if you like. The first few I did dynamically, and that's a great way to prepare the muscle for a stretch. And you just continually try to bring that muscle into a little bit more of an elongation. It's coming from your pelvis, so you want to drop your pelvis down. You want to think about getting your kneecap long and to the wall behind you. Very nice. And release. And we'll do that same stretch on the opposite side. So breath in, exhale, and we're going to just do a dynamic stretch first. 1, and down, slow and controlled. And 2. And again, this is a bonus strengthening for your hamstring, controlling the muscle as it goes down. And 3, but now we're just going to hold this delicious stretch. Whenever you're doing a stretch, you don't want the intensity to be super strong. You want the muscle to feel invited to relax. So the intensity of the stretch should not exceed about a 5 out of 10. It should be like a really nice, relaxed stretch. If it's feeling too intense, by all means, just release the stretch a little bit. If you're looking to increase the stretch, sink your pelvis down and elongate your leg as though your kneecap is trying to reach the wall behind you. Excellent. Good. Enjoy it for another breath or two, and then slowly release. So many of my patients find it takes a lot of effort to do their exercises every day. And especially since, 5 might not feel too bad, but as you build and you want to build up to 10 repetitions and then gradually build even a second set, what most people find most successful is if you don't do all the exercises every day. So with what we did today, if you did the first 2 exercises on one day, the next day you're going to do the next 2 exercises. And on the 3rd day, you get to do your last strengthening exercise with the stretches. So that way you get to do something every day. You just keep repeating your cycle, day 1, day 2, day 3, and gradually you'll be able to build up and build stronger muscles that are going to allow you to be more active. Now, something that really complements this is to incorporate some balance. And so I really encourage you to look at my balance video here so that you can start getting more sure-footed and help strengthen the leg muscles as well as your balance at the same time. So thanks for joining me today, and I wish you a lovely day.